Hi, my name is Stan.
My name is Connie.
My name is Judy.
My name is Alien, and I'm a caregiver to my mother.
And I care for my mother, Octavia.
And I'm a caregiver for my mother.
And I'm a caregiver to my husband, Art.
I'm a caregiver for my wife, Ann, who's 72 years old.
Basically, I've done everything for providing for both of them.
I take care of my mother on the weekends. I take her grocery shopping.
Not only household chores.
I provide her medical care, coordination, driving, errands.
Choosing meals, making meals, cleaning up.
I find that I take care of anything that he can't take care of.
Sometimes I find balancing time a real challenge.
The difficult part for me is taking me into consideration.
Balancing her needs with the needs of my family, the needs of my marriage, and my own needs.
Staying calm, nice, and positive.
The real challenge is, of course, the distance and the moment you get that last phone call.
What I love most about taking care of her is knowing that we're providing a secure and comfortable home for her.
It's the time we spend together.
Is the adventure of finding out new things all the time to trying to help him stay out of pain.
My name is Ed. I'm a spouse and I'm a caregiver.
My name is Colette. I'm a daughter and a caregiver.
I'm a caregiver, and I'm a daughter.
And I'm a wife and a caregiver.
I'm a daughter and a caregiver.
I'm a son, a nephew, and a caregiver.
Hi, my name is Debra Day, and I help manage United Way Caregivers Coalition. While caring for a loved one has its special rewards, it's a very challenging job. It can be stressful, overwhelming, and sometimes lonely. Each caregiving situation is unique, but all caregivers share the need for information and support. And that's where the Caregivers Coalition comes in. We help caregivers receive the support they need to take care of their loved ones and to take care of themselves. Caregivers who lead healthy, productive lives will be better caregivers. The most important thing to remember is that as a caregiver, you're not alone. So what we're going to do is have a panel presentation on the topic being the pieces of the puzzle that need to be in place to keep your loved one at home. The things we're going to cover in this presentation are the need for the family to do an assessment of their loved one, of their functioning ability, what you need to know about home safety, if home care is needed, how you can pick the right agency and how you can pay for it. And we're going to give you ideas for keeping your loved one stimulated during the day, both in the home and outside the home. To answer these questions, we have a panel of experts with us today. We have on the left Deanna Butters, who is the director of Sage Eldercare's Spend-A-Day Adult Day Health Center in Summit. Deanna keeps track of clients and their families to make sure that they're equipped with the tools that they need to care for their loved ones. Next to Deanna is Diane Meza, who is a physical therapist with over 25 years of experience in the Medicare certified home care industry. And then last but not least is Joanne Haberlin, who is a patient care liaison for a Medicare certified Joint Commission certified home care agency, Patient Care. Joanne evaluates patients for eligibility for care and educates facilities and physicians in the area related to care. And with me to ask the questions of the panel is Ruth Rothbart-Mayer, who is also the chairperson of our Munch and Learn Committee with the United Way. Ruth is a licensed clinical social worker and a certified geriatric care manager. She's in private practice assisting families and individuals. Ruth is going to direct questions to the panel, and they're going to hopefully answer most of what we're attempting to cover tonight. And at the end, if you have questions, you can direct them to anyone on the panel or just to the panel in general, and hopefully we'll get a lot of your questions and concerns answered and give you some information that will be very helpful to you.
What is and why you need a formal or an informal home care assessment? Talk about assessing the individual for needs, what their needs are.
So one of the things, and I too have been a caregiver, so I understand what you're going through. There are a lot of different areas that we look at when we look at the person. I do it as a physical therapist, Joanne does it as a nurse. Deanna will do it as a caregiver outside of the home. But the first area we would look at, if you're wondering, do I keep this person in their home? Do they have to go somewhere? Can they be by themselves? One of the areas is how are they eating? And that is huge. Can they shop for themselves? Or do they need someone to shop for them? And if they do, it could be someone like you. It could be, Stop and Shop has like Peapod that will deliver. But again, you have to be able to order that food. So can they do that? Can they prepare a meal safely? Can they still use that stove? Or do they maybe just need to use the microwave? Are they getting enough calories? Are they taking in nutritious food? You also have to know, or they have to know, their medications. Some of their medications will have different foods that they should or should not eat with the medications. And that should be listed on the sheet that you get from the pharmacy that says these precautions.
What you could talk about is, what is a mini-mental?
It's a term that we use. It's not really the mini-mental exam, but it's a mental evaluation, which gives us a baseline of what that patient's mental and cognitive functioning is. It will ask them to recall a series of things, apple, house, rodent, whatever it may be. We'll ask them if they know what date, time, who they are, where they are, and that's orientation. Are they oriented to person, place, and time? So that we get a good idea of where they're at. A lot of times you can talk to somebody for an hour and not realize that they're forgetful.
So part of what you're doing is you're looking at whether here's somebody that you know very well, you think you know very well. Somebody told me recently that until their mother came to visit with them and stay for a couple of weeks, that the daughter had not a clue that her mother was unable to pay her bills, didn't know how to write checks in a checkbook anymore. And so what are the other kinds of things that families should be looking for when they come into their family member's home and are looking to see what needs they have?
Well, a lot of times we look and make sure, especially with the safety issues, are there things that are piling up? Their mail piling up, they're not opening it. That's a good indication they're not paying their bills. Or are they hoarding, or their magazines and things that are scattered about that may be a hazard issue for them walking? Is there maybe the medical devices that they're using, are they holding them and using them correctly? The oxygen, is the tubing in the way? Are they able to access the
walker or a wheelchair?
Is it measured correctly? Is it fitting them properly? Are they using it properly? Are they using it at all?
I know a lot of times when you're trying to set up services like home care, a lot of things that people forget to do is to put their information in one spot. Especially with seniors or people that are forgetful, to try to find that living will, to try to find the advance directives when they need it. These are things that they're going to need as part of signing up for a home care service. So for people that are caregivers and people that are not, it's always really good to have one spot that you know that you can go to get that information. I don't know if you guys have heard of the Vial of Life. It's something that's hopefully through your local responders, emergency responders, where you have this packet of all the information, medications, doctor's numbers, family's information. If you are a caregiver to a senior that lives alone, make sure that the police department or the fire department have a note, or you call them to contact them, let them know where that information is if you're concerned that that person is forgetful and won't know where that info is.
So just summarizing this part of it, I think we've covered a fair amount, but you're looking at all aspects of what the home looks like, and you're looking at how your family member is negotiating in the home. Are they eating properly? What about their eating habits? Have they changed? Are they dressing? Are they dressing with clean clothes? Are they wearing the same clothes all the time? What are some of the other kinds of things that you would notice when you walk into a house? Not as a professional, but as a family member.
The way they're dressed is huge. Some people may have the same clothing on for 2 or 3 days, and they make it very offensive if you say something to them, and that's another cognitive thing where they don't realize they've been wearing the same clothes for 2 or 3 days. You're also going to unfortunately check for any indication of incontinence. They may be denying that they're incontinent, but you may be smelling something. That would be an increased reason for having urinary tract infections, and obviously just if you took them out, they would be getting stares from people. So you want to make sure if they're incontinent, you may want to think about getting maybe a home health aide in to help them with their bathing.
Okay, so wrapping this up, there are a couple other things that people could be looking for, and that's access to shopping, access to all the things that we need in life. Getting to your church, getting to family, getting to friends, getting to programs. And of course you talked about the ability to prepare meals and looking at those kinds of changes. So let's talk about home safety.
From a nursing point of view, I want to go in and I want to make sure, as she said, there's food in the refrigerator, there's appropriate food in the refrigerator, that they have clear pathways that they can negotiate into. The lighting, which is something that an occupational therapist also would be involved in. We do a quick overview, and then we have our physical therapist, occupational therapist do a more intense view of the home. But when we go to see a patient, especially as nurses, we're like, well, how are you with bathing yourself? Do you have any issues getting in and out of the tub? And they may say, no, I'm fine. And I'm like, show me. Because I want to see them do it. I really do. And a lot of times they don't want to appear to be needy, or they think that you're going to come in and say, oh, now you need to go to a nursing home because you can't do this. That's not it at all. We want to be able to make sure that they can, in fact, negotiate these different obstacles and safely. So we may say, you know what, we'll just get you a shower chair or some grab bars, or we'll make sure that we can make this safe for you. Also, what's in the cabinets? Things in the cabinets, sometimes if I know what medication they're on, can interfere. If I see a lot of things that are high in sodium, or if I see a big package of spinach in their freezer and they're on Coumadin, these are things that would, do you eat that all the time? Because that's fine, but if not, you can't have a big spinach salad and expect your PTI&R to be normal. Just things you have to be very observant and look at the house and see what you see.
Again, with home safety, our occupational therapists, they do the ADLs, or activities of daily living. They look at the bathroom safety. Joanne and I were talking about this, but if they have shower doors on their tub, please get rid of them. Put them out in the garbage. Put them wherever. I don't care where. But they're very, very dangerous for people. They need to have grab bars, and they need to have grab bars that are not the same color as the walls. The worst color for grab bars, guess what it is? Silver. Who said it? You're right. Silver and white. They are the same color. So what our therapists will do is we find waterproof tape, and we will tape the grab bars so that they can see it and use it safely.
You'll see people with dementia not be able to distinguish between a plate and cauliflower. It's the same color. So as she was saying, as a caregiver, you guys have so much other stuff to think about now that these, your family members are losing certain functions. Something as simple as the color, say the color of a toilet, against a white wall, a white toilet, a white wall, maybe she won't see it. That can cause, that's a fall risk. So, I've had clients where something as simple as putting construction paper behind the toilet so that they're able to see that pop out outside of that white wall helps with that, or it helps the men in terms of finding it. So it's simple, but you really do see a difference when I've actually seen a difference in people when you introduce something as simple as construction paper.
Along those same lines with the color, one of the home safety things that is huge is stairs, steps, curbs. We've gone in and same thing, like with the tape, a lot of people tend to have dark colored carpeting on their stairs. We will take bright yellow tape and just tape the edges close to the edge on each of the risers, And it's amazing. We've had people who have just gripped both hands on the handrail. And they go one step at a time, leaning on the handrail. And that same day, I will tape their steps and say, now come down the stairs. And they go step over step, holding on with one hand on the handrail down the stairs. It's because they never realized that that's what was happening. They couldn't differentiate each step. Light switches have to be very accessible. In older homes, I know some of the light switches on the stairs are only at the bottom, not at the top. So to have an electrician put that second light switch on, we've also taught a lot of our patients they have to go upstairs and turn on the light like at 3 o'clock now because it gets dark early. So when they go up later, they will have lights on for when they go to bed. Pets, they all love their animals. And their animals are wonderful for them. But you have to be careful. I know cats tend to go in and out of walkers. And as therapists, we used to say, put your pets away, and we would work with the people in the great environment. Now we work with the pets around because that is the real life. But you do have to be careful with pets, small children, etc., with the older people. Again, oxygen storage, and are they using the devices that they're supposed to be using? They should only be using walkers, canes, crutches, whatever it is, if they've been instructed to use it. They should not be going to the pharmacy and picking something out themselves and saying, oh, I just decided I need this. It needs to be adjusted to the correct height, and it needs to be on the correct side of their body to use it.
So once we've dealt with taking care of the home aspect and the home safety piece, now you want to incorporate that outside social piece for these guys. And so the first thing I would tell you guys to do is to, one, get on the internet. Do a Google search. I've actually done these because just to see what else is out in the area besides where I work. And Google really does bring up some really good options. Say you pull up an adult day, you get their name, and then below it, people can make their comments. Read those. Call the places, ask questions. The place, if you're going to adult day programs, you want to go and visit the places. I have folks that call and say, hey, so my loved one needs an adult day. We don't need to come visit, but he's going to be fine. That, you want to get out there and see the places that your loved one is going to be. You, besides evaluating the safety at home, you need to evaluate where these folks are going to be going as well too. So in early stages, you want to be able to see if you can get that person into more independent programs like a YMCA or a senior center. As you move into different stages of dementia or even just physical ailments, and social daycare or an adult medical daycare may be better options. Social daycares are I would say for higher functioning folks. These are just designed for socializing, somewhere that someone can come in, meet some friends, and gain a new group of folks to talk with. What you get in a medical daycare is more of a comprehensive service. This is where you'll have a physical therapy that's coming in, to physical therapy, occupational, or speech. They have medical directors that can track the medications that your loved ones are on. Dietitians that come in to look at the meals and look at the meds to make sure that the meals and the meds go together as well, because they're saying that there are certain foods that you can't eat on certain medications. Also in medical daycares, you'll be able to get funding through the state, through the government. In social daycares, they're usually private pay and a lot cheaper because they don't incorporate these other pieces to the puzzle.
Deanna, I'm going to interrupt for a second. I'm going to get back to you because there's a lot about maintaining stimulation that you're going to be covering. So thank you for that.
Oh, you're
also,
welcome.
medical day programs have a nursing staff, right? And activities as well. So let's just go on. How do you pay for this? What are the ways that you can pay for day programs or for home care? What kinds of funds can people gain access to?
I just wanted to talk a little bit about some free things too first.
Absolutely.
The township community resources that your town may have, There's always a township nurse. There's usually a social worker for the town. They can be of assistance as well.
In the home, how are they helpful?
Oh, community nurses visit patients in the
They will
home.
come into the home.
They absolutely, yeah.
And how do people access them?
Through your township. You call the township nurse, and they'll hook that up. I've never heard of any town that doesn't have one, you know.
But they'll come out and do an assessment, or they'll come out and do what?
Yes, and they work very well with all of the resources that we're talking about
Good.
here, with medical daycares, social daycares. They can assess and see where that patient really needs to go, whether it be to an adult medical daycare or whether they just need some physical therapy short-term from some other agencies or some nursing that'll get them back on track. Also, the VA, if you are the spouse of a veteran, or if you are a veteran, the VA has a lot of programs that might help. The Alzheimer's Association has the one-time grant, and they have respites, and they have any medical disease state usually has an adjoining club or organization that supports people with these diseases. So you have an MS association, you have all these different associations, of heart disease, and they can also be a great asset to you to help find some free or low-cost assistance and things.
For adult day programs, for social programs, like I said, a lot of them are usually private pay. They're cheaper because they only encompass that social piece. If you want to have your family member go to adult medical day, you do have a lot more options when it comes to funding. Each county, through the Older Americans Act, there's certain monies that's set aside just for adult day programs for people that live in that county. So if you, this is Essex County, you guys have funding that's available to you guys. There is a needs assessment that's required to receive these funds as justification for giving it to the families, but each county here in New Jersey has these funds from the Older Americans Act. There's also the Department of Health funding for Alzheimer's and related dementias. That will approve, again, it's needs-based, so they do need financial information. That will approve for 3 days at a lower price based on what that person, their income is annually. I have members that are paying $4.11 a day on that program for 3 days a week. So it's something that's statewide. It's not specifically to a county. And you can transfer it if you move to another county. It will transfer. That's actually pretty easy. Medicaid also does cover adult day programs. Now with the HMOs that have taken over, if you decide to go into to apply for Medicaid, there are 4 HMOs. There are 2 more coming out. Aetna and someone else has decided to jump in as well too. But the 4 HMOs are the folks that we work through to be able to approve payment for the services. And that's United Healthcare, Horizon, Amerigroup, and Health First. Right now, Aetna, and I can't remember the other HMO that's trying to get into it, but you have to go through these HMOs to be able to get approved funding to be able to come to an adult day program. Make sure that they apply for 5 days and not say you only want your family member to go 2 days, and after 2 days you realize, oh wow, she really likes it and you want more days. They have to reapply for those other days. So you want to make sure that initially that you're applying for 5 days so that if you decide to add a day, you can do that without going through the paperwork again.
Can families approach any of these funding sources by themselves, or do they have to have approval from an organization that does the reaching out? So like the State Respite Fund is one that you cannot access by yourself.
The state
Can you talk about
respite,
that?
yeah, the state respite you can access on your own. You do have to call the county to get the application and to go in and to meet with them, but that can be used in state facilities. It can be used at adult daycares, as well as for home care as well too. But some of the programs that I'm telling you about, like the county funding, the Department of Health funding, the Alzheimer's grant you can get outside of a facility. But for those other programs, you do have to go through a program because you're getting the approval for them to attend that program.
So now we're ready to choose a home care agency.
I wanted to talk a little bit about first, to try to see if there's not a skill, possibly go through your religious organizations. If it's just a companion you need, they're not skilled in any, they don't have any certifications or anything like that. But if all you need is basically someone to sit with them, make sure they don't wander, make sure they eat appropriately, a lot of times your church will be able to help you find someone like that. Wanted to talk too about what's in place now may not be what's sufficient for them down the road. We have to. It's a changing thing. Obviously, what's good for us this week may not be good for us in 3 months. So the changing needs of your people that you're caregiving for have to be assessed as well. So maybe a companion was good, and maybe now they need some skills. In that case, the Medicare certified home care agencies, we will go out and do assessments. Physical therapy, occupational therapy, speech therapy, those are skills. And that's something that the Medicare certified agency can provide.
So now we're just looking for someone to be in the home. We want an aide who will help our family member. What are the questions that we're going to talk to friends, we're going to go to a religious institution, we're going to talk to anyone we know to get ideas of home care agencies that perhaps they've used. NewJersey.gov site is a good alternative to look for home care agencies. And the Caregiver Coalition membership is also a good way to get
Senior Blue Book.
And the Senior Blue Book,
There's
right.
a lot of
And so how does a family decide how many hours a week their family member might need?
Well,
do they start with that as when they call the agency? Do they discuss that, or is that part of the
Nurses will come
determination?
out and assess for any agency to see what they feel the patient's needs are. But keep in mind, this is out of pocket normally, unless you have Medicaid or a Medicaid program that pays for this.
Or long-term care insurance might.
Right. Anything that is out of your pocket, you may want to consider that too. And you can balance that with sometimes a family member that can help for a few hours a day versus having a person that you have to pay for the entire time. So sometimes if you want to just, have a break, put them in for a couple hours a day so you can go do things that you want to do.
Focus on home care. What are the questions that a family needs to ask of the home care agency before they...
Languages, maybe if you have a special language that the patient needs to be spoken to in.
Language is huge, especially if the person is hard of hearing, and if the caregiver has a very strong accent, they may not understand them. So you want to be able to interview the aide, and I would also say if the aide could come to the home for an interview. So you want to make sure that aide or companion and the person they're going to be taking care of get along. You want to make sure that aide knows about the disease process that person has. You also want to make sure that if this aide is going to be cooking for the person, that they have likes as far as food. There is one agency that I've used in the past that has a lot of Polish-speaking aides. They make great pierogies. But if the person they're taking care of doesn't like pierogies, they're stuck. So you really have to ask about what kind of food they are going to make. You also have to talk to the aide one-on-one about what are their expectations, what do they expect in the home, and what your expectations of them are. They may think that you're talking more a companion, and once I give Mrs. X a bath, I'm just going to sit and talk to her. You may have wanted Mrs. X's sheets changed and some wash done, and maybe make a meal, etc. So you have to make sure that you're all on the same page as far as what is required.
You also want to be very specific when talking to whoever it is that you first get on the phone. Be very specific about the type of care that you need. If it is that you are struggling with toileting, they need to know that. It's not just an overall care issue that you need help with, that it's specific. And I say that because they know their aides. They know what these aides are capable of. They know what they're not. You want to make sure that you're asking, well, how long has this aid worked for you guys? How long, or have they worked with a client with dementia or Parkinson's or whatever, because you don't care for them the same. Are they going to do activities in the home? What is she qualified to do? Because a lot of the complaints sometimes you hear is that, oh, well, mom says they don't do anything during the day. Okay, well, during that first initial meeting, are you giving them that information? Well, mom used to knit. She doesn't do it anymore. Have that be something that the aide wants to work on her with. But they need to know a lot of background information, what your family member did for a living. If it is somebody with dementia, those are the functions that you want to go back to. Those are the things that you want those aides to address, not the new stuff, because that's not the stuff they're going to be able to do. You want to ask if you have an artistic aide, if you have a family member who loves art. So you want to be very specific with what your family members' abilities are and what they're not, so that you can get those answers on the phone and not waste your time.
What else do you want to know about bringing someone into the home? What the home care agencies are requiring? What they are requiring?
What type? I forgot this one. What type of education? How are they equipping their aides? I know training, especially with dementia and Parkinson's, those are two very difficult diseases, both physically and cognitively. How are they supporting their aides? What type of training are they giving them? Have they brought in other programs to assist the aides with understanding sensitivity, cultural issues? Think about the person who is having this person come into the house. They're already uncomfortable with the fact that you guys are aware of their deficits. And now we're bringing somebody else into the mix. The sensitivity has to be there. And you'll know that after the first couple visits with those aides. You'll know if you want to continue with that service or that home care agency once you address those concerns and see what the result is. Because a lot of times they will address it by changing the aid, not changing the behavior.
Okay, very good, very helpful. You also want to know if the agency has a minimum number of hours. You want to know if they do only 24-hour care. You want to know things about, you want to ask for a job description. You also want to find out who comes in to do the nursing assessment and how often the nurse comes out to visit. If there's a social worker in place, what does the social worker do? How often do they come out? What is their role? Who oversees the work of the aides? And who do you call if you have a problem with an aide? Or you feel that the aide isn't appropriate? Are you comfortable saying to the agency, or who do you address when you feel that the aide is not appropriate? The other thing is, we didn't talk about driving. Does the aide drive? Usually an aide will drive the family car. So that's just another question to keep on tap. Well, Deanna, we're ready for you. We've got home care in place and we want to be stimulated. Help us get stimulated.
Oh. All right. Well, before you introduce adult daycare, if you are looking to introduce multiple services, you have to know your family member. Depending, and I say dementia a lot because this is the reality is this is what we're dealing with. With people with dementia, initial stages, like I said, being able to coordinate multiple services may be easier than when it's going into that mild or more moderate confusion when you have, I don't need it, I'm okay, I'm fine, I can do this on my own. That's usually when it's fear. Their fear of leaving the house, their fear of putting themselves in an environment that is different and then having other people recognize that you are different. So for the family member, for the caregiver, that's the first thing you need to think about. Am I overloading my family member first off with a home care and then to put adult daycare on top? So make sure that you're giving them enough time to adjust to both if you're doing it. And also, if you are looking into adult daycare, know your family member. If addressing it prior to going into these places will work for them, do it. Don't just drop it on them when you go into the facility because it causes more fear, more anxiety. what you're saying to them is that you didn't think that you could tell them about this service, so you wanted to sneak it up on them. And what that says to me, and any individual that gets snuck up on like that, is that you didn't trust that they would be able to handle that information. And that opens up another box of fear. So introducing adult daycare is a very tricky thing to do. And when you're trying to do it, make sure that the director or whoever is helping you coordinate it is on board with whatever story you're going with. Each adult day program should have a health assessment that needs to be completed. The physician is going to communicate with that facility about what medications they're on, what type of care they're going to need, their diet, their physical functioning. But adult daycare is another really good option to long-term care. I see how you can have someone with a mild dementia still maintain certain pieces of their independence by coming into a program with people that are just like them, probably going through the same situations, because I've actually heard them at the table. Oh, my daughter doesn't think I can do this anymore. That's why I'm here. So, you know, they're communicating with each other as well, too. So it's just another really good option to open this box that's closing for them, because we're taking away so much. It seems that something like this can open up a little bit more joy with the socialization with other folks. I know sometimes just getting up and leaving the house for folks. We have observers, people that don't necessarily aren't very social, but sometimes just having that person sit and observe what's going on, they will find their niche, or we will help them find their niche in whatever that environment is.
Supposing people can't get out of their homes, what can they do in the home, and who can help them do it in the home?
There are home care agencies out there with aides that are certified dementia practitioners, or have activities training, but this is where you have to be specific. You guys have to be the informants to the folks coming into your house and telling them what it is that your family member likes to do. If there's a certain section of the house that that they like to be in at a certain time of the day, that's where the activity is going to be. If it is that they have their own routine, they have to watch Price is Right, or these other shows. I particularly like soap operas. Who knows? Whatever it is, it has to be incorporated into that person's day. And initially, you might want to you do want to hang out and see how that home care person is going to set up that routine. Because once they get them into that routine, that is really what creates the activity, the routine part of it. A lot of times people think that it has to be a game or art or whatever, but if it's something different that person was not doing when that person was not in the house, it's an activity and it's something different for them, and you're forming a new program. So,
very good. Yeah. You got.
I just wanted to say something about, especially if they're living with you, in that new environment. A couple of things you want to remember about getting them stimulated is, especially if you're near to where they lived, have their friends come by. A lot of people forget that they have friends and other people that are very important to them. We've had patients who maybe had someone from their church come and give them communion every morning or on Wednesdays, and now the daughter forgot that that's very important to them. So anything religious, let them continue. Let them help with some chores. They've gone from their own environment to your house, and they feel like they're barging in. So a lot of people will just, let them, if you've done laundry, let them fold all the socks, let them do the washcloths, let them do the hand towels, give them the small things to fold. If you're making a simple meal and you need somebody just to, with their hands, cut up some lettuce or something like that, let them help with simple meal preparation, but have them sitting at the table to do it. A huge thing if they're in your house for stimulation is grandchildren. Grandchildren come off that school bus, and I can tell you every single one of our patients what time those kids get off the bus, because they are looking out the window. And have that child sit with grandma or grandpa, tell them about their day in school, tell them about what homework they have. So that generational thing is huge. So, when the kids have to know what 2 + 2 is, have grandma and grandpa help them with their math homework. So the stimulation of grandchildren, put an animal on their lap and let them pet it, whatever it is in the home, bring it into them. Okay.
Thank you so much. We're going to take some questions. So how do you find a medical daycare in Essex County or locally?
At the table, there is a list that I made. Actually, our social worker did a list of adult daycares in Essex County. It's over on the table for you. And on the back page is adult daycare funding sources, and it tells you to go to the Essex County Division on Aging. So that is available for you. Okay.
So the question is, what is the Vial of Life and what goes in it? Go ahead,
Right.
Deanna.
The Vial of Life is being used in Summit. I know that for sure. The Summit emergency responders came up with that idea, and we are now using it as well too. Each of your, whatever county that you're in, you might want to call to see if they have it under another name. But what you did is perfect, because basically that's what it is. Grab a Ziploc bag and put all of that information in it. That basically is what the Vial of Life is.
And what's in the Vial of Life? It's the advanced directives,
Advanced
the living will.
directives, living will, phone numbers that your loved one may forget, next of kin, physicians' numbers, medications.
Current medication.
Right, current medication. So it may be something that needs to be updated as their care changes, or as they get new doctors incorporated into their care, that kind of stuff.
And the latest is if there's a POLST, which
Right.
is a document that one can do with a doctor, and it becomes an order of care, but it's end of life.
Right.
The statement was the Vial of Life could be seen on, you could go online and look it up. There is a whole package. One of the things that was mentioned was a decal that you could put on the front door, which is discouraged because you don't want to flag that there's a senior in the home. So the question is, how do you incorporate a home care worker into your home while still maintaining your own lifestyle?
We go in temporarily. Each of our people is in the house for about an hour. We try to respect whatever the family wants. We also, if we are in the house and we don't need the caregiver to help us with anything, we will also tell the caregiver to go out for a walk or whatever they want to do while we're there, to have a little bit of time. You also have to make sure that your needs and wants are known to whoever is coming in. And that's huge. You have to sit down with them and explain, and they need to explain back, so everybody is on the same page. I don't know if that helps you at all, but it's got to be a give and take. I know it's hard. If you do have a 24-hour live-in, you might want to say, okay, at night we're fine. I will just call you if I need you. And they maybe have a separate room on a separate level of the house so that you do have your privacy. You want to be able to say that, yes, we need some time to ourselves, and that's okay to do.
And initially, you might want to start out slow. You don't want to just jump in and say, okay, she's coming 3 days a week for 5 hours. Again, it's overwhelming. Initially, you just want her or whoever it is to come in to just supplement the care that you're giving, to initially gain that trust of your husband, gain the trust of you, really. She can come in, follow you, see what your routine is. That way you feel a lot safer when you're not there, that she knows what is supposed to be done at what time of the day. But you don't want to jump all in with like 15 hours a week when you just introduced the whole topic.
The question is, how do you handle personal property when an aide is in the home? And if it's something that's really dear to you, if it's fragile, if it's expensive, secure it. Just put it away and secure it. That guarantees that you know where it is at all times, and that will alleviate your questions about what is the person doing in the home when you're not there. And even though the agencies are bonded, you can't be guaranteed that somebody wouldn't knock something over that was expensive.
She wanted to know if you needed a script or a diagnosis from the doctor to be able to gain services for adult daycare. No, you don't. But for specific funding sources, you may have to. The Department of Health one that I was just telling you about, you do need to have a script from the doctor. It has to be specific as to what type of dementia. They cannot just put dementia or senile dementia. It's not accepted anymore. It has to either be Alzheimer's, Lewy bodies, vascular, whichever one they think it is.
But to be eligible for an adult day center, a medical day center, you do have to have a diagnosis of some kind. So you wanted to have a home assessment from an occupational therapist, and you were having a hard time finding someone to come in. Are there occupational therapists or agencies that will come in and do an assessment?
If it's a Medicare certified agency, we do have occupational therapists. Under Medicare A, the person has to be homebound, however. That doesn't mean they have to be bedbound. It just has to be a taxing effort to get out of the house, and they have to require assistance to get out of the house. The assistance can be just meaning you have to have another person with you. If those qualifications are met, absolutely an occupational therapist can come out to the house, like through our agency or another Medicare certified agency. But occupational therapy cannot be the only discipline that comes out. It has to be a nurse, a physical therapist, or a speech pathologist in addition to it. So if there are like medication issues, the nurse could come out possibly for 1 or 2 visits, and then the OT could just continue. Under Medicare, occupational therapy is not considered a primary service.
So I think the answer is that unless you go through an agency, that you would not have, you could probably get an occupational therapist to come out for a fee. But apparently there's not independent people coming out to do that. But there are people who do home modifications that you might want to look into if that were a question. But it sounds to me like you want something a little bit more detailed,
And
like how to do things in the home.
You could
to
call
manage.
like an outpatient facility and see if someone would come in, but it would be, under Medicare B then. And then there's a copay.
We're going to wrap up. Thank you so much, everyone, for coming. Thank you, Patient Care, for supplying the dinner. Thank you to our experts, Deanna, Diane, and Joanne, and Ruth. Thank you for coming, and I hope we'll see some of you next week at our coalition meeting on Tuesday.